My book of the year this year is called Searching for Normal. It's by Sami Timimi. He works in the UK as a child and adolescent psychiatrist and psychotherapist. And it's taken me a couple of months to get through this one. There's some pretty heavy concepts. At times it feels like you're reading more of an academic book than a popular trade book that you buy on the shelves. And yet the conversation about mental health, the conversation about diagnoses, about neurodiversity, trauma, and so much more, it may be one of the most important books that is on bookshelves at the moment. So today, a conversation with an author that I have been so excited to talk with, Sami Timimi. That's coming up in just a sec on the Happy Families podcast. Stay with us. G'day, welcome to the Happy Families podcast, real parenting solutions every single day on Australia's most downloaded parenting podcast. Dr Sami Timimi's new book is called Searching for Normal. It's a new approach to understanding mental health distress and neurodiversity, and it asks a question that every parent is quietly wondering. Have we started treating normal childhood struggles as medical problems? Has psychology become too medicalised? After 35 years in child and adolescent psychiatry, Dr Timimi has seen how quick diagnoses like ADHD and autism and anxiety can sometimes overshadow what kids really need, which is understanding and connection and support. He helps parents to tell the difference between genuine mental illness and the very real pressures of growing up in today's world. In the book, he says, your child isn't broken or abnormal. Psychiatric labels are cultural inventions, not biological destiny. When distress is medicalised, it steals our hope. But if we can find another story, we can break the cycle that has trapped too many for too long. Dr. Timimi, so good of you to join me on the Happy Families podcast.
Well, thank you so much for inviting me. I'm delighted to be here.
So as I said in the intro, I was reading your book. I had a few pages to go, and then your publicist got in touch and said, would you like to interview this man on your podcast? And I just thought, oh my goodness, what a great opportunity. How can I say no? I've loved the book. In the book, you argue that much of what we label as a disorder may actually be an understandable human response to difficult circumstances. And immediately, in the context of ADHD and depression and anxiety, I thought this is the kind of thing that is provocative, it's volatile, it's the kind of thing that a lot of parents are going to take potentially offense at because, well, we love our labels. And in the current psychological state that we're in, there seem to be more and more people who are saying, my child is definitely not right. So I'd love for you to talk a bit about how parents can tell the difference between ordinary distress or ordinary hyperactivity and impulsivity and the typical ways that children behave versus a real clinical concern that needs extra help.
One of the things that I was trying to get across in my recent book, Searching for Normal, is one of the difficulties of trying to figure this stuff out is that we don't really have an understanding of what we mean by things like normal. So I know the title of the book is Searching for Normal, but the idea of normal assumes that we have an understanding of what we mean by normal.
Is there a problem with that definition, normal, like from a clinical or mental health sense? What can be problematic with definitions like normal?
The problem is all the definitions that we use in mental health are subjective, and therefore they're concepts that are that can be expanded in all sorts of different directions because we don't have what you would call empirical anchors, something definite in the physical world that can make you differentiate between something that's a problem in the hardwiring, if you like, of the brain or the body from things that aren't.
Can you go a little deeper on that?
The problem then becomes, because our definitions are all subjective, we literally don't know what we're talking about when it comes to mental health. And it becomes in the eye of the beholder. And the thing that we all have in common is that when we have various issues, various problems that we're trying to understand, is that we are meaning-making creatures. And the frameworks that we use to make sense of these presentations, of things that worry us, of things that concern us, are very powerful in terms of how we then understand and how we then react and how we then imagine what the type of problem that the person is experiencing is all about. The thing is, you can't see a thought under the microscope. So one of the difficulties for all parents, and one of the things that I say to parents when I meet with them is that one of the things that I can't do for you is deal with guilt, because all good parents feel guilty most of the time. That's just something that we have to accept, because we love our children, and we're surrounded by these narratives that are in our society at the moment that make us imagine that there are all these disorders and problems, and that you should identify them early and that you should intervene early. So you can't blame parents for wanting to go down these pathways.
Oh, totally right. But what are some of the problems or issues that can arise if parents do choose to go down the pathway of early identification and intervention?
The problem is, if you go down these pathways, there is a danger that your children are going to be exposed to the issues of labeling. And sociologists have known about the problems with labeling and the power of labeling. And then you're exposing your child to the potential harms that can come from them internalizing an idea, and you as a parent and your teachers and all the other people who they're going to come into contact with internalizing this idea that there's something wrong, that there's something broken, that there's something about them that means that they're unable to function in society as it's made at the moment. So rather than being able to help parents tell the difference between a clinical problem and a non-clinical problem, which I think is, that depends on each person's situation and what's going on in that family, in that young person, in their peer group, in their school, and so on. What I would give some pointers to are a few things that I think would be helpful for parents to keep in mind in helping them negotiate this difficult area, because we're so surrounded by this narrative that there's all these vulnerabilities and potential disorders lurking in the background. So my first tip would be, don't try too hard.
I love that.
Because we live in a society that puts pressure on us and our children to perform. And the problem is we can then see our children or ourselves as primarily vulnerable. And then we get drawn into noticing all sorts of ways in which their mental or behavioral health could go wrong. And we could then be launched into a seeming never-ending search for the right diagnosis or the right treatment. And in doing that, we risk collecting labels and the various accompanying interventions. So that's one thing I would say. Please don't try too hard. I think when we're very worried about our children, when we're driven to guilt, there is the temptation to intervene unnecessarily.
What's the second one?
The second thing I would suggest to parents is, don't fear emotions. When we put emotions in the class of problems that can only be solved by special expertise, like a specific therapy or worse, as I said, psychiatric medication, what we risk in doing that is losing agency and alienating ourselves from parts of ourselves that are to be experienced rather than feared. Our job as parents, if we're going to allow our children to grow and develop psychologically, is to understand that we can't prevent all suffering, disappointments, and our job instead is to be there when our children have these difficulties in their life, when they're going through emotional upheaval and emotional distress, is to be there, to be patient, allow this to happen, and help them on their way.
You've mentioned the first two things, don't try too hard and don't fear emotions. Tell us the third idea.
The third thing that I would say is see nurturing relationships as a greater priority than controlling behavior. Because when we're distressed by behavior of our children, we often hope we can get through to them so that they change in a way that would stop them doing the sorts of behaviors that we're considering things that we're worried or frustrated about or irritated by. Unfortunately, when our attempts to kind of control behavior can accidentally damage a relationship. So for me, one of the things that I've put as a priority in my work with young people and families where there's a lot of worry or where there's a lot of worry about behavior and behavior that is causing distress or frustration or irritation to the parents, is to focus on emotional flow. So on the emotional dynamic between the young person and their parents or their family more widely.
Okay, so we've got don't try too hard, don't fear emotions, prioritize nurturing the relationship versus controlling the behavior. I love this one. It's something that I still struggle with my own kids. So I love this one. Tell us your fourth and final one.
The final one that I would put in there is beware of what I call concept creep. So concept creep is something that's been happening quite a lot in our culture recently, where concepts that were originally developed in clinical world, whether it's in psychiatry or psychotherapy, have sort of leaked out into our culture. My kids, when they were growing up, they're now adults, started talking about some years ago feeling depressed, not feeling miserable, not feeling frustrated, but feeling. So that was, I think, one of the first examples of words that came from a clinical world and crept into the everyday life. But we've got all sorts of concepts that have now crept in, from emotional regulation, emotional intelligence, meltdowns. So children now have meltdowns, they don't have tantrums. So these kind of more ordinary bits of language. And the reason why I think you should be careful of starting to think in those terms is that they draw you towards an idea that what your kid is experiencing is outside of the realm of the ordinary, outside of the realm of what we consider to be the social world of expectations, and in the realm of a potential problem.
Today on the Happy Families podcast, we're talking to Dr. Sami Timimi, who has over 3 decades experience working with children and families as a psychiatrist and psychotherapist, and is the author of the new book, Searching for Normal. After the break, we'll talk neurodiversity and the increase in ADHD and autism diagnoses. Stay with us. This is the Happy Families podcast. Today, talking with Dr. Sami Timimi, author of Searching for Normal, which I reckon is one of the most important books at the moment that covers issues such as mental health, trauma, and neurodiversity. ADHD and autism diagnoses, and just the idea of neurodiversity. There's been an extraordinary increase in exposure to and conversation about that. I would say probably over the last, let's say, 10 to 12 years. What do you think's driving the surge? And what should parents do about it?
There are many factors that would be driving this, and it is quite an extraordinary expansion. What has happened over the years is what I call a mutation of constructs. And this comes back to what I was saying earlier, that because the definitions are subjective, because they refer to behaviors rather than, you don't get a blood test for ADHD, you don't get a brain scan. What you do is you have a questionnaire, and or in terms of autism diagnosis, there's also some observational tools. And I've done all the training in all of these, and I'll be quite honest with you, they're no better than pop psychology quizzes that you might find
on Facebook.
Yes, yeah. Even the ones that appear to be more sophisticated, they're just more sophisticated versions of the same thing. They don't have any empirical anchors. And what that means is that they can be expanded, and they've become expanded in 2 directions. So they can become expanded horizontally by including lesser degrees of behavior presentations. So lesser behaviors can be included, or lesser severe behaviors can be included, and then they can be expanded vertically, which means that new populations that previously didn't have the likelihood of these diagnoses enter into the realm of diagnosis.
Sami, can you give us some ideas, some examples in terms of ADHD and autism?
With ADHD, and you can see a very similar pattern with autism that happened a few years later. It starts out as, in my clinical lifetime, I trained in child psychiatry back in the mid-90s, and we didn't diagnose anybody with ADHD. There was something called hyperkinetic disorder, which was focused on levels of behavior, so activity levels. And this was a very rare disorder. So in my first 9 months of child psychiatry, I didn't see anybody who was diagnosed with this condition. And it was also at that time considered that if you had significant learning difficulties, that would automatically exclude you from such a diagnosis, because it was considered that learning difficulties by itself would be a reasonable explanation for why you might be struggling with your behavior. Then the concept of ADHD got imported from the US, and it starts out with a prevalence rate of about 0.5% of children. Over the years, this expands, and eventually it becomes about 3% of children. At this point, it's still thought of as what we call a developmental disorder, which means that the expectation was, as children grow up, most of them would grow out of it. However, by the early 2000s in this country, the concept of adult ADHD was beginning to creep in. So this is your example of beginning to vertically expand. So the idea that it was a lifelong disorder and something that was not likely to recover from was happening. And now the concentration was also on ideas of attention. So attention comes more into the picture, levels of attention. So this is a new behavior being brought in. And then in the last 5 to 10 years, but particularly in the last 5 years, the concept of masking allows it to go even further. So the concept of masking is you actually have the symptoms, but you don't show them.
Yep.
Because
you're keeping them hidden
you
until
keep them inside
you're home and it's safe to let it all
exactly.
out. Yep.
And so this allows a greater degree of women to come into the diagnostic category, women and girls. So by now, it's expanded to 5% in some countries, 10% of the population, and rising. And in doing that, it also starts to become incorporated into identity politics. So as it expands, you also got a group of people who understandably rejected some of the medicalisation of this, but instead still kept the whole idea that there's something neurological going on. So that's where the neurodiversity comes in, which I think is a bonkers concept. I'll be perfectly frank with you, because we're all neurodiverse. But this idea that we can separate a group who are neurodiverse, who are unable, if you like, who have a problem functioning in society as it's made at the moment, and a group who are neurotypical, in which society is made for us. Well, all of us are struggling with the way society is.
So if you look at the big picture, what are the potential drivers of this expansion?
They are, to my mind, partly a crisis of economy. So people are feeling insecure, pessimistic about the future. So there's a greater degree of distress. This level of distress, level of insecurity that people have, becomes a potential something to exploit for profit.
Yeah, it's a gold mine for big pharmaceuticals, and
it's been a gold mine. And this is why I call what's happened the mental health industrial complex, because in the last few years, there's been a rapid expansion of expensive assessments, of books, of podcasts, of magazines, of self-help manuals, of online programs, not just the pharmaceuticals, but there's a whole raft of things I really feel the current generation of young people growing up have been and are the most pathologized generation that there has been. And that really worries me, because I think we've been setting young people up, and there's so much evidence now to suggest that that's what's happening. We're setting young people up to be disempowered and sometimes to be unnecessarily disabled.
It's a solid take. It's a provocative take. It's the kind of take that gets people to sit up and pay attention. And I'm sure that there's going to be a lot of people that have a lot to say about it. Personally, I think the book is needed. I think it's a vital insight into where we are from a mental health perspective in the current climate, and a great call to action in terms of how we can make some changes. Sami, I could talk to you all day. I reckon if you and I could sit down over a coffee table with couple of nice drinks and some snacks, you and I could probably talk for 2 weeks and solve all the problems of the world. It would be so much fun. But for now, we're going to have to leave it there simply because time gets the better of us. Thank you so much for being generous with your time and having a chat with us about your new book, Searching for Normal.
Thank you so much for inviting me.
The book Searching for Normal is available right now everywhere that you buy your books. One of my favourite books of the year. There's no way for me to say it without being any more excited about it than that. I just loved the book. Dr Sami Timimi, practicing consultant child and adolescent psychiatrist and psychotherapist, working previously with the NHS in the UK. He's written 40 book chapters, mainly in academic books, although his most recent one before Searching for Normal was called Insane Medicine, How the Mental Health Industry Creates Damaging Treatment Traps and How You Can Escape Them. Check out Searching for Normal, a new approach to understanding mental health, distress, and neurodiversity, wherever you buy your books. The Happy Families podcast is produced by Justin Rulon from Bridge Media. Mim Hammonds provides research, admin, and a whole lot of other support. And if you'd like more info to make your family happier, please visit us at happyfamilies.com.au.